Hi everyone. Thank you, Dami, for the kind introduction. So I'm Hui from Malaysia. Thank you very much to the organizer for providing this opportunity to share the topic on AI chatbot to overcome stigma-inducing interactions and enhance HIV testing and PrEP uptake. So there are no conflict of interest related to this presentation. This is the outline of the presentation. So before we start and move into AI chatbot, let's just start with some brief background about HIV epidemic in Malaysia, because I believe the audience here are from many countries across Asia Pacific and even globally. So you might not know that much about Malaysia. And in Malaysia, the HIV epidemic actually continues to grow. And over the past 2 decades, the HIV transmission mode has mainly changed from injecting drugs and towards sexual transmission, particularly within men who have sex with men, MSM, and which is why later on I will discuss more about our use of AI chatbot among MSM. So what are the challenges in terms of HIV testing? As we all know, HIV testing is a prerequisite to improve HIV prevention and also treatment uptake. But what stands in between? This is actually a survey from Malaysia. You can see there are actually discriminatory attitudes towards people living with HIV and even children living with HIV. Our general population, about 30 to 50% of them, they are not comfortable to just buying vegetables from people living with HIV and even allowing children living with HIV to attend the school together with other children. We might think that, okay, this survey was done in 2014 to 2019, and things might have improved. So, look, a similar survey was done in 2022. Is it improving? Nope. The stigma and discrimination actually escalated. The percentage actually went up to about 40 to 60%. So if you ask me, are we progressing much in terms of confronting stigma and discrimination? I would say probably no. This is another news from Malaysia itself. It was in 2018 where the police and government officials raided one nightclub in Malaysia. And it has raised some discussions and controversies regarding state-sponsored homophobia after LGBT breakdown. And same-sex sexual behaviors are actually criminalized by both secular and Sharia law in Malaysia. This news was years ago, and guess what? Last year, we have several news regarding this. We have kill switch order, we have confiscating LGBT rainbow swatch watches. You'll be like, okay, even watches need to be confiscated now. Okay. So these are some interesting news from Malaysia that I would like to share to let you know that that's the state of stigma and discrimination that is happening in Malaysia. And our people living with HIV, they actually reported a very high level of internalized stigma. And even stigma in community settings, there are about 20% of them actually reported that also. So all these actually are barriers for them to access HIV testing and also PrEP uptake. So this is a report from our country. So in 2019, there was approximately only 40% of our key populations who was reached with PrEP and also had their HIV tested. And interestingly, in 2022, the percentage has increased tremendously to about 78 to 80%. So we can see there's actually a lot of improvement in terms of PrEP and also HIV testing, probably because of development of our digital health. And this is what I'm going to discuss later on. The role of artificial intelligence in healthcare. Yeah. So how AI, how chatbot actually help to reduce stigma or tackle HIV testing, PrEP? Okay. So basically, mHealth or mobile health, it can help to increase the HIV testing because it can help to protect the privacy. It can reduce in-person contact, which is the concern of many of the key populations. It can also help to improve medication adherence, mental health, and social support. On top of this, chatbots is scalable, it's widely accessible, it's easy to use, and it provides very efficient information dissemination. Chatbots can also learn from and interface with patients. I believe many here would have some experience of using chatbot, be it Siri, ChatGPT, or even other chatbots from other apps. So you definitely have some experience with it, where chatbots, they are really good in learning, and they can really provide very quick and informative information. Besides, chatbots are actually able to reduce costs, improve patients' outcomes, and also enhance health practitioners' work efficiencies. So all these factors actually led to this development of the AI chatbot in Malaysia, and it's called Haris. I'm not sure whether you noticed at the title slide, there's actually a small picture of Haris beside. Yeah, that's our cute little chatbot. And the name Haris actually is a common name, a common Malay name. So we want to make it somehow nearer to the populations. So that's why we name it Haris. So before we start developing our chatbot, we actually did a formative evaluation of the acceptance of HIV prevention AI chatbot, because you don't want to develop something that people are not interested to use. Yeah, you want to make sure this is something they need, they want, and they will share, okay? So what we did was, we actually did focus group discussions with 31 MSM in Malaysia. We actually use Unified Theory of Acceptance and Use of Technology, UTAUT, as our conceptual framework. It emphasized on 4 things: the performance expectancy, which is the perceived usefulness, whether this chatbot is able to provide useful information, otherwise who would actually use that chatbot? Besides, you need focus on effort expectancy also, because if the chatbot is very difficult to use, no matter how informative, how good it is, no one will use it, okay? And facilitating conditions. So we want to know what are the things that will encourage people to use this AI chatbot. And last but not least, our focus today, social influence, the social cultural factors that actually facilitates or impedes the use of AI chatbot. In this, we will discuss about stigma and discrimination later. So this is a brief summary from our study. There are some helpful features suggested by our participants to actually facilitate the acceptance of HIV prevention AI chatbot. So first thing, definitely, you must have useful information. Yeah, that's the basic of any, not only chatbot, or probably mobile health technologies. So first, providing the useful and accurate information, because this is how we build trust within the participants. If you provide some wrong information or inaccurate information, I'll tell this is probably the end of your chatbot, because no one will be using it later on. Besides, they also want a chatbot that has problem-solving capacity, because when you access the chatbot, you have questions. It means you have questions. You wanted to ask questions. You wanted to know more. So your chatbot need to have this feature, able to answer people's questions. Other than that, you have to make the Q&A easy. So that's why participants actually suggested that you can provide some guiding questions and answers, and later on I will show an example of how we actually guide the conversation with the chatbot. Besides, because our chatbot, it focuses on HIV testing. Other than testing at the facility-based healthcare facilities, we also provide HIV self-testing. And this is where we focus a lot, because we wanted to reach the key population through the chatbot, and we want them to have HIV self-testing. They can get the HIV self-test kits through the chatbot and test it at home themselves. So this actually is one of the major development in this chatbot. Other than that, yeah, social cultural factors that I have been mentioning. Reducing stigma. So how can chatbot reduce stigma? It's mainly through protecting your confidentiality and also reducing the in-person contact. So how you want to reach them? Our participants actually suggested, why don't you just embed it in some MSM-friendly platforms? So that's what we did also. Later on, we actually embed it in Grindr, Hornet, yeah, or Telegram. Yeah, these are the MSM-friendly platforms. I'll share some interesting experiences while interviewing our MSN. They actually mentioned that, there are several platforms, but I think it's better for you to share it through Telegram, Grindr, all this, and instead of Facebook or Instagram, because there are a lot of stigmatization over these platforms. If you post anything regarding this in Facebook, we just tends to get a lot of not that nice comments from people. Yeah, so that's why choosing platforms is another very essential component. And last but not least, protecting privacy. Of course, make sure any information that the participants provided in the chatbot is protected. So these are some quotes from our participants. I will not go through them one by one. And for the images, it's actually generated through AI chatbot also. So now it's the era of mobile health, digital technology. So there's no copyright issue with this. And I just actually randomly typed, I want image of Asian young boy. Okay, and this actually came out. Yeah, they provided me with a few choices to choose from. So the four domains that I mentioned just now, the performance expectancy, effort expectancy, facilitating conditions, and also the social influence. For this presentation, I'll probably just focus on a few quotes. So the one under facilitating conditions, if you are able to see, chatbot actually link between our key populations and also our healthcare service. You might think that, I thought they only access the chatbot to get information, stuff like that. But the participants mentioned themselves, when I am accessing the chatbot, I'm actually letting my guard down. It's already breaking the barrier. And the chatbot can actually provide some information on the address of the clinics or which clinics they have the HIV facilities or services. So this is how it acts as a bridge, okay? Other than that, social influence. Yeah, as we have mentioned, stigma and discrimination is still a very important barrier in Malaysia in terms of accessing HIV services, which is why social influence, they said they are not so comfortable to get their tests at the clinics. They are not so comfortable to engage in conversations about HIV, and that's what deters them from seeking for help. And this is how AI chatbot comes in. So this is some examples of the interface of our AI chatbot. You can see we actually provided some guiding questions and answers. Our chatbot actually focused on 3 areas: HIV testing, PrEP, and mental health. No doubt these are the major components of HIV, okay? So the examples that I show here is more towards the HIV testing part. So it will provide information on what are the testing benefits, and then you can see they can choose whether to test at home or test at the clinic. If they choose to test at home, the chatbot will actually ask for their address, and it can, later on someone will actually send the HIV self-test kit to them. And if they choose to test at the clinic, the chatbot will ask which area are you in, and then come up with a list of the clinics with HIV services available. And the participants can choose to email the list to their emails, okay? So after we develop the chatbot, of course, it's not just developing. You need to implement it. And before implementing, you need to test it. You don't know whether this is something that is good enough. You need to improve it. And what we did is beta testing. So we tested the feasibility and acceptability of using AI chatbot to promote HIV testing and also pre-exposure prophylaxis. And we did a mixed method study. So there are 3 phases in this beta testing. First is chatbot human interaction for about 45 minutes and using think aloud method. So in this method, the participants actually access the chatbot through a URL, and then he will share the screen. Why we call it think aloud is because you are actually speaking your thoughts. So the participants will be accessing the chatbot. He will be given a few tasks, like ordering the HIV self-test kits and such. So while he is trying to complete the task, he will say, oh, I find this feature is quite interesting. Oh, okay, this one is a bit complex. He will be mentioning what are the things that he encountered or what does he think about the chatbot. That's why it's called think aloud method, expressing your thoughts. Next, we have semi-structured interviews, focusing on what do you think, what is your experience with this AI chatbot, and how do you think we should disseminate the AI chatbot. And last but not least, we had an online survey where we actually investigate the feasibility of AI chatbot through a Likert scale. Later on, I will show the results. We also use system usability and also adjusted chatbot usability scale. So this slide actually shows the results from our online survey. The upper part is the feasibility testing. As we can see, the participants are quite satisfied, I would say, quite satisfied, and they are happy with the chatbot because about 80% of them said it's of good quality, they are satisfied, and more than 85% actually intend to use this chatbot, and they are willing to refer to others, and this is what we wanted. And under the system usability skill and also adjusted chatbot usability skill, there are 10 items each. I definitely won't go through one by one here. What I wanted to highlight are just probably a few, because most of them actually we receive positive responses from the participants. So I would just highlight a few that not so positive responses from them. So under the system usability skill, we can see item 5 and also item 9. The percentage of them agreeing or neutral is quite high. So what are the things that they think we can improve on? There's too much inconsistency in this chatbot. Okay, so I think this the participants actually mentioned something like your font, your alignment is not that good. Yeah, so that's more of the technical part, I would say. So this is where we need to improve. And also the 9th, chatbot is unnecessarily complex. Well, for some of us, it can be quite complex when you use the chatbot, right? Yeah, but of course, we need to try to simplify it to make it more easy to use for most. As for the adjusted chatbot usability skill, the items that I would like to highlight is questions 6 and also questions 9. 6 and 9, they both actually lead to a similar thing, which the participants think that the chatbot is not natural enough. First one is because the chatbot responded too quickly. And the second one is the interaction with the chatbot doesn't felt like natural conversation. So the first one, I think is a very common experience of us when you deal with chatbot. The ChatGPT, the Siri, they all could give you answer in seconds, which at the speed that human could never achieve. Okay, so this, but if we were to ask the chatbot to answer the questions in minutes, I think you will complain more than be happy with it. Okay. So the next one is the conversation is less natural. So for this, we actually try to incorporate some words like boleh and also making it more mimicking the human conversation. So because our participants say that as much when you use a chatbot, you want it to be more, the conversation to be more human. Otherwise, I can just access internet and look for the information myself. Okay, and so these are the parts that we can probably improve on. So there are also quite some quotes from the semi-structured interviews that we conducted. So for due to time constraint, I also won't be going through one by one and just focusing on the social influence part, because today we talk about stigma and discrimination. So what the participants have mentioned that AI chatbot actually help in reducing stigma and discrimination because it is very comfortable of getting the HIV test kits on site. I don't need to feel afraid of stigma, afraid that the society will judge. Besides, my identity will be kept confidential. Okay? So just the last few slides. What are the impacts and outcomes from our experience with AI chatbot? The feasibility and acceptability are high. It's really high among our participants. And although stigma and discrimination, it is a barrier for them to access HIV testing and prevention, but it's actually a primary facilitator for them to seek for health information via internet-based platforms. And AI chatbot also provides a platform which is MSM-friendly and provides them with empowerment. It also provides alternative pathway to interact with healthcare providers. So some future research and development suggestions, We need to develop innovative and culturally tailored AI interventions, promote public health not just in Malaysia but in all countries, advocate for changes in discriminative policies and laws, and also enhance testing, implementation, and sustainability of this AI intervention. So this is the end of my presentation, and thank you from Haris.